1. What is percutaneous endoscopic gastrostomy insertion? Definition. Percutaneous endoscopic gastrostomy, percutaneous endoscopic gastrostomy, insertion is a medical procedure in which a feeding tube is inserted directly into the stomach through the abdominal wall using endoscopic guidance. This feeding tube provides nutrition to patients who are unable to eat or swallow food normally due to conditions such as neurological disorders, stroke, or cancer. 2. Percutaneous endoscopic gastrostomy insertion procedure. Steps involved. 1. Preparation. The patient is sedated, and an endoscope is inserted into the stomach to inflate it with air. This helps the doctor locate the appropriate spot for the tube. 2. Insertion. A small incision is made in the abdominal wall, and the feeding tube is carefully inserted into the stomach. 3. Securing. The feeding tube is secured in place, and feeding can typically begin within 24 to 48 hours after insertion. 3. Percutaneous endoscopic gastrostomy feeding. What is percutaneous endoscopic gastrostomy feeding? Percutaneous endoscopic gastrostomy feeding involves using the tube inserted during percutaneous endoscopic gastrostomy insertion to deliver nutrition, fluids, and medications directly into the stomach. There are two primary methods: bolus feeding, manual feeding using syringes. Continuous feeding. A feeding pump is used for a steady supply of nutrition. Care considerations. Percutaneous endoscopic gastrostomy feeding requires careful monitoring to avoid complications like infections, tube blockages, or gastrointestinal issues. 4. Risk factors and complications of percutaneous endoscopic gastrostomy insertion. Potential risks during insertion. 1. Infection. Infection may occur at the insertion site or internally within the abdomen. 2. Bleeding. There is a risk of bleeding due to injury to blood vessels during the procedure. 3. Perforation. Accidental puncture or injury to internal organs can occur. 4. Aspiration pneumonia. Inhalation of stomach contents into the lungs, leading to pneumonia. 5. Peritonitis. Infection of the abdominal lining can develop after the procedure. 5. Risks of percutaneous endoscopic gastrostomy feeding. Complications related to feeding through the tube. 1. Clogged tube. Feeding tubes can become clogged due to thick feed materials or medications that aren't adequately flushed out. 2. Diarrhea or constipation. Improper feeding formulas or intolerance to the food can lead to gastrointestinal issues. 3. Aspiration risk. Incorrect positioning or feeding technique can cause stomach contents to enter the lungs, resulting in aspiration pneumonia. 4. Tube dislodgement. The feeding tube can become displaced or dislodged, leading to leakage, infection, or the need for reinsertion. 5. Malnutrition or overfeeding. Improper nutritional calculations or feeding schedule can cause malnutrition or excessive feeding, leading to complications like dehydration or electrolyte imbalances. 6. Summary of percutaneous endoscopic gastrostomy meaning. Definition of percutaneous endoscopic gastrostomy. Percutaneous endoscopic gastrostomy refers to the procedure in which a feeding tube is inserted into the stomach through the abdominal wall using endoscopic guidance. The tube provides long-term nutritional support for patients who are unable to eat by.
Your health is your greatest asset, and I'm here to help you take care of it. If you enjoyed this video and want more simple, effective health tips, make sure to subscribe to stay updated. I share easy-to-follow advice on nutrition, fitness, and overall well-being to help you live a healthier life. Got any topics you'd like me to cover? Drop a comment below, I'd love to hear from you. Thanks for watching, and I'll see you in the next one. Stay healthy and take care.